Hello, thank you so much for tuning into my channel. This is Dr. Kehinde Elisha, founder of FNP Certification Academy. Today is December 11th, 2024. The year is about to be over. Are you struggling to pass your ANCC certification examination at any level? ANCC is critical thinking, a lot of critical thinking. So today I'm going to be teaching you how to critically think. We now have critical thinking skills and clinical application added to our review for all specialty, PMHNP, FNP, AGNP, AGACNP, and even NCLEX exam review. So the critical thinking is something that we need to get us through the test. So I'm going to quickly demonstrate what we go through and how we do the critical thinking skills, how engaging it is, and just a taste of it. And then hopefully you'll be convinced to sign up with us. If you want to sign up, you're going to visit www.npcertificationacademy.com. And you can email us for questions and info@npcertificationacademy.com or nurse-to-nursecoach@gmail.com. You can also call us at 347-901-6037. We're now going to go ahead and get started with the very first neurotransmitters. That's the main thing we're going to be using today to demonstrate the critical thinking skills that we need to get through the test. We're also going to be going over questions not in this sample in class. We're also going to demonstrate. I will sketch some things here and bring some real life example of how you can connect with this on the exam. So exam is more than memorization, especially ANCC. You really have to understand your content. There are no strategies without content, absolutely none. You must know your stuff. Now let's get started. So the very first one I want to talk about is psychopathology, Alzheimer's disease. So when we have Alzheimer's disease, what neurotransmitter is implicated? That is the starting point. Don't forget. We have many neurotransmitters. I'm going to give you a quick overview. We also have neurotransmitter for depression. We have neurotransmitter for anxiety, for bipolar. So we have different neurotransmitters and different brain parts that affect those things that I just showed you. But we're going to focus on just Alzheimer's today. So now with Alzheimer's disease, the main neurotransmitter implicated in Alzheimer's disease is acetylcholine. Acetylcholine is down in Alzheimer's disease, and that's the way you're going to apply this mnemonic. Acetylcholine is down in Alzheimer's disease. So AD is equal to AD. Listen, our focus at NP Certification Academy, we don't read to you, we teach to you. We help you understand because we know you can read before you came to us. So we focus on helping you understand what you need to pass the test. So have you been struggling? The critical thinking is maybe what you're missing. It is part of our review, okay? We just don't go through Quizlets. We just don't go through content. We go through everything and we make sure you are soaked in it and you will be ready for your test with 99.9% pass rate. You'll be making the best choice. Visit www.npcertificationacademy.com or email nurse-to-nursecoach@gmail.com. Now, to continue on to neurotransmitters. Now we have neurotransmitter acetylcholine, right? Implicated in Alzheimer's disease. My interest today is acetylcholine. Glutamate and serotonin are also implicated in Alzheimer's disease, according to major textbooks like Stoll Psychopharmacology or SADOC textbook for Psychiatric, and a lot of research from NIMH. Now, we have increase or decrease. Decrease acetylcholine. Okay, we have the increase or decrease section here, but it's a decreased acetylcholine. Don't forget, Alzheimer's disease is equal to acetylcholine decrease. AD is equal to AD. Now, I'm going to tell you the clinical application of this in a minute. Which brain part is implicated? Hippocampus, cortex, and parietal lobe. What are the pathways implicated? You're going to notice that the pathway is also connected to the neurochemicals. Cholinergic pathway, glutaminergic pathway. They are directly linked to the, same neurotransmitter that is affected in this patient. So as an NP, what exactly is the best application of this? Let's not forget, NPs should monitor for cognitive decline because once you connect this with your Alzheimer's disease, you will know that this patient is having Alzheimer's disease, so you want to focus on your cognitive decline, memory loss, functional impairment. Now, this is now what I want to settle with. How do you now treat them pharmacologically? This is now the clinical application. You want to teach them with cholinesterase inhibitors. Now, with cholinesterase inhibitors, listen, This is an enzyme normally supposed to break down acetylcholine, but we're going to inhibit it from doing so. So as we inhibit it from doing so, guess what we're going to do? We're going to go ahead and build up acetylcholine. So when we build up acetylcholine, guess what we're also doing? We are also dropping the level of dopamine, because dopamine and acetylcholine have an inverse relationship. So now, as you are fixing the patient with Alzheimer's disease, we are also indirectly dealing with Parkinson's disease on the side, because of the inverse relationship. Whenever we elevate the level of acetylcholine, we are also reducing dopamine. As you reduce dopamine, that is equal to PD. So Parkinson's disease is as a result of low level of dopamine. Can you now see the relationship? So that is the clinical application. So as you're studying this content, you must be able to get it down to pathophysiology. That way you can think. ANCC exam is not straightforward. However, it is very straightforward with our review. Our students go in and they tell me, Kehinde, I did that test in 2 hours. I did that test in 1.5 hours. And some people, 3.5 hours is just not enough for them. I really hope you enjoyed this breakdown and I hope you learned, but we have more neurotransmitters to worry about. This is not all inclusive. Speaking here is Dr. Kehinde Elisha, founder of NP Certification Academy. To learn more, visit www.npcertificationacademy.com. We look forward to having you in class. Have a wonderful day. Bye-bye.